Last night in the Dáil, we got an opportunity to question Simon Harris, the Minister for Health, about the scandal around the cervical screen testing. I have to say, I think most of us would be very dissatisfied with what came back at us, which wasn't dealing with the questions at all. So we didn't get answers. We got obfuscation, and I think the whole point of last night's session was to try and deflect from what the real issue is. And don't get me wrong, I think the announcement that he made that another 1,500 women, a scandalous amount, were not audited but in the famous 2014, the now famous 2014 audit for their smear testing. And those 1,500 women, he tells us, already have cancer or already being treated. But the real scandal here is, as Vicky Phelan has said, was the outsourcing of cervical screening in the first place. So you go right back to 2008. And at that time, Mary Harney was the health minister. The government was made up of her, the Green Party and Fianna Fáil. And she wanted to outsource the cervical screening to the USA. She was, of course, being advised by the head of the cervical screening service and programme at the time, none other than Tony O'Brien, the now infamous HSE boss. And they looked at the cost of carrying out the screening here. They wanted to extend the programme, and fair enough, that would have meant to have to extend the services that we could provide here in Ireland. But instead of extending the training, the laboratory staffing and sourcing and funding the increase of the service here, they went outside the country to America. They were warned by no less people than Dr. David Gibbons, who was at the time the chair of the Quality Assurance Committee for Cervical Cytology and Pathology in the cervical screening programme, which was run by Tony O'Brien. So Dr. David Gibbons is echoed by the Master of the Rotunda, Sam Coulter, who warned that testing being moved to private companies overseas would result in problems that would mean cancer cases being missed. The actual science behind it is shown by a study done in St. Luke's Hospital, which looked at 14,500 smear tests read by the company who won the contract in America, Quest Laboratories. And that showed that there was a 30% difference in the pickup rate for high-grade pre-invasive cancer of the cervix from Quest to the results that were being achieved by St. Luke's and other laboratories throughout the country. So right from then, the most passionate opponents of the outsourcing, Fine Gael and Labour, who were in opposition at the time, James Riley and Jan O'Sullivan, and people who stood up and screamed at the government, don't do this, outsourcing will lead to misdiagnosis for up to 30% of women. The government go ahead and do it. The Fianna Fáil Green Mary Harney government go ahead and outsource, and lo and behold, a couple of years later, there's an election. Fine Gael and Labour get into power. James Riley becomes the Minister for Health, and what does he do? He did nothing. Then you had Leo Varadkar, Minister for Health, and what does he do? He did nothing. And now we have Simon Harris, Minister for Health, and what does he do about this discrepancy? He does nothing. And these were the points we made last night, and we asked a series of questions which he failed to answer. And one simple question I wanted answered was, where does your test go? And what guarantee do you have now, currently, that your test is actually not substandard? Whether it goes to Med Labs in Sandyford, which, by the way, are a sister company of the company in Austin, Texas that Vicky sued, or whether it goes to Quest Laboratories in New Jersey, or whether it goes to the Coombe. How do you know where it's going, and how do you know if it is not a substandard test that you're getting? Now they're telling us, we can go back and get tested again. By whom? Can we rely on the outcome of those tests? They're also telling us that the audit could be extended to other women, but who carries out the audit? I mean, who examines whom in all of this? And these kind of questions Simon Harris utterly failed to answer. Perhaps he doesn't know the answers yet, but for sure people in his department know the answers. So what they're trying to do now is deflect away from the real source of the problem, which is the privatisation of a seriously important aspect of women's health, the outsourcing of it to America, deflect from that by looking at the audits that took place, and by looking at who told who what and who tried to cover up what. I think we really need to go back to basics and look at what was said at the time by very many credible institutions and individuals who work with women's health in this country. We need to look at why did Dr. James Riley vehemently oppose the outsourcing and then say nothing when he became Minister for Health. All of the big parties in the Dáil are complicit in this, and that's why they don't want to talk about the outsourcing. They don't want to talk about the historical legacy that's been left where women's health cannot be trusted in the hands of private companies. Private companies, by the way, who operate for profit, not for our good. So I want to echo a call that was made by the Association of Laboratory Technicians and Scientists, and I want to say that first of all, we need to see the results of the entire 2014 audit. And secondly, we should begin to repatriate the screening service to this country. But I want to add to that it's not just good enough to repatriate it, we need to take it back into public ownership and control and make it a not-for-profit health service. And we need answers. And Simon Harris has not given them to us. Somebody has to be accountable.